So parasympathetic system, let's look at what's happening. The brain is sending a signal down, and when it sends a signal down, it goes to the preganglionic neuron first. So it's going through the preganglionic neuron, and it's releasing neurotransmitters. And these neurotransmitters are called ACH for acetylcholine. So acetylcholine is the name of the neurotransmitter that gets sent through and released over here. These bind to the receptors over here, so it goes, the dot will merge over here to these Y-looking receptors, and it travels to the postganglionic neuron, where these acetylcholine neurotransmitters get released again. And when they get released, they will bind to the receptors. So again, they bind to those Y-shaped receptors. And what will they do? Well, they'll do what it has to do. So if it's a parasympathetic autonomic nervous system that we're looking at, the neurotransmitters will bind to the receptors, and when it binds to the receptors, it'll tell the digestive tract to start, moving the food along the tract. It'll tell the bronchi to constrict because we don't need a lot of air, so it'll tell the lungs to, slow down a little. It could bind to, so with this, it can travel, the neurotransmitters can travel, and it can bind to the heart, and it'll tell the heart to slow down. The neurotransmitters, these dots over here, can travel, and it can go to the salivary glands, and it'll tell the salivary glands to start producing more saliva. When you look at the sympathetic nervous system, okay, so in the sympathetic nervous system, the signal gets traveled, and the first neurotransmitters that gets released is still the acetylcholine, so it's very similar to the parasympathetic acetylcholine. But what's interesting is that the second neurotransmitter at the end over here is not acetylcholine. So it was acetylcholine for parasympathetic, but for the sympathetic, the second neurotransmitter that gets released is norepinephrine. So just know that there is a difference. It's norepinephrine neurotransmitter that gets released. Now let's look at these receptors. So you'll notice here that some of the receptors is alpha 1, some of the receptors are beta 2, beta 1. So let's look at what, and so alpha 2, so let's look at what these receptors mean. So if a neurotransmitter such as acetylcholine or norepinephrine, if they bind to the alpha 1 receptor here, what the alpha 1 receptor does is it does vasoconstriction. So what that means is that it will constrict. So if a neurotransmitter goes over here, it will constrict the digestive tract so that the food can travel along nicely. So one of the functions of the alpha 1 receptor is it helps with vasoconstriction. Another thing that it does is the alpha 1 receptor also helps with nasal decongesting. So if your nose is stuffed up, and a neurotransmitter or a drug kind of binds to the alpha 1 receptor, it will help with your nasal congestion as well. What about alpha 2? So alpha 2 is known as it has another word, it's also known as an autoreceptor. And what an alpha 2 receptor does is it basically, you'll see it only in the postganglionic neuron. Okay, so if you look over here, we don't see any alpha 2 receptors here. Alpha 2 right here is only seen in the postganglionic sympathetic nervous system. So this neuron is where you see the alpha 2. And what it does is it helps with norepinephrine. So it stimulates the norepinephrine. It actually inhibits the norepinephrine from getting released so that it decreases blood pressure. But for now, all you need to know is that the alpha 2, it hangs out with the postganglionic neuron. We don't see it in the preganglionic neuron. It hangs out in the postganglionic neuron. What about beta 1? So we see beta 1 receptors here. So when neurotransmitters bind to beta 1, it will affect the heart. And remember, we looked at this last time. Beta 1 is, I'm just going to use a pen over here so that we can identify this better. So this is beta 1 over here, beta 1. And because there's one heart, If we are using beta 2, so if it binds to a beta 2 receptor, if a neurotransmitter binds to a beta 2 receptor, this is beta 2. And the way you can remember it is that there's 2 lungs, right? 1, 2. And what that means is that if a neurotransmitter stimulates a beta 2 receptor, it will affect the lung. So the lung will either start opening up or start closing. And if a neurotransmitter binds to the beta-1 receptor, it will affect the heart. So the heart can either pump faster or slower, depending on whether the parasympathetic system is activated or the sympathetic nervous system is activated. So let's actually look at this over here. I'm just going to look at the sympathetic nervous system. So again, we're recapping everything. Sympathetic autonomic nervous system is when you're scared, when you're fighting or flighting for your life. And what's interesting to know is that it's also, if you were to take a drug, if you were to take a drug that will stimulate this response over here, the name of the drug or the category of the drug could also be called sympathomimetic drug or adrenergic drug. Now, how can you remember this? Because if you look at the opposite, parasympathetic autonomic nervous system is known as the parasympathomimetic or cholinergic drug. So the way I remember it is when I look at this adrenergic drug, I think of adrenaline, and when you're having this adrenaline high or this adrenaline rush, there's so much energy that's flowing into your body, and you have so much energy so that you can run away from the bear, for example. So think of it like that. Like think of adrenaline when you get that adrenaline rush. So if you take a drug from the adrenergic family, then what's going to happen is that your adrenergic receptors will get stimulated. So let's look at this with this example over here. So let's actually put it over here. So sympathetic nervous system, you take a drug, that drug gets traveled through the neurons, and then it binds to, let's say it binds to the lungs. And if it binds to the lungs, what's going to happen is my lungs will start opening up. So a drug that falls under the adrenergic category is a sympathetic autonomic nervous system type of drug. And what it does is if you have this drug, and you take albuterol, for example, it's going to open up the lungs. And so that way you can breathe better. So albuterol is a good example of an adrenergic drug because it opens up the lungs. Let's look at the opposite. There is actually another type of drug. It's called the anti-adrenergic drug. And this is a drug that if you take this drug, it will block the receptors. So these receptors over here will be known as adrenergic receptors. Okay, adrenergic because think of adrenaline. Adrenaline is, you're going through that adrenaline high, and is going to cause this type of response in your body. You're going to feel what he's feeling. And so in this case, if you take an anti-adrenergic drug, that means you don't want to feel what he's feeling. You want to feel the opposite of what he's feeling. So an example of that is a beta blocker, which we'll look at later on. But a beta blocker is a type of drug that when you take this drug, it will bind, or it will block the receptor here so that the heart doesn't pump fast, so that the heart can slow down, because it's anti, which means you do not want this. You want the heart to not pump faster. You want it to slow down. Anti, right, means not. You don't want to feel this way. So if you don't want to feel this way, you can take a drug from this category, and it will travel down over here, and it will block the receptor. So it'll block the receptor over here, and when it blocks the receptor, the heart was forced to slow down. And when the heart slows down, the blood pressure also decreases, it goes lower.